Good morning, everyone. You are very hungry. I decided to cut down my speed by about 7 minutes. Very outside. Let me all wish you very auspicious of 79th Independence Day. Thank you all for your nice gesture. My warm regards to all the happy veterans who did actually participated. Governor Brahma, Major Lakshmi, and Major Abhijit. To start with, let me just tell you a small story. This story dates back to 1973, when again happened to be Independence Day. My fourth day of work in NHS London. Out of the blue, my consultant just passed a remark. They said, "No, Dr. K, you guys shouldn't have got independence so early. Should have waited for some more time." I did not know how to react to that. At the tip of my tongue, there was an enormous saying, those who deny independence to others, they don't deserve independence for themselves. And I also had this to say to him, one of the famous playwrights, George Bernard Shaw. He said, "The liberty is the freedom of every nation." So I didn't say me anyone about this. That is just because I was 26 years old and I was still wet in my ears. But over the years, this question actually kept on haunting me. So perhaps there must be some truth in it. Why is it that? Partially, perhaps he's correct. We are not good organizers, but we don't accept it. We still have that Chaturanga attitude. Now you, the Swami, that attitude also is there. And our work culture is actually grounded into hierarchy. Unlike America, which is actually based upon innovation and also based upon the individual. And we are very narrow-minded. We come to accept the fact when it comes to actually language, caste, religion, boundary. So perhaps we can actually widen it a bit. And when it comes to the nationalistic feeling, or nationalistic feeling only confined to actually sports. Perhaps we can do a little better here also, at least national interest or national security. Having said that, tell me which country is perfect. So despite of all this, India has made a tremendous progress in the past about 17, 90 years, which you cannot think about. Be it being the infrastructure, being the defense sector, or even our foreign reserve. As a matter of fact, recently, our man Sudhanshu Shukla has returned back from space after conducting successful experiments. You can just imagine 70, 90 years ago, moving from village to actually town, it was a Herculean task. But now, we put our actually scientists into the spacecraft as if you're putting them into the BMTC red bus and we're getting them back. So, when you talk about actually advancement in the health sector, you don't have to look anywhere else. Just look around Shikoga. You have at least about 3 to 4 specialists in every branch of medicine. And we have actually really flooded with multi-speciality hospitals. But having said that, it doesn't mean that we don't have any problem. We have actually a problem of communicable diseases. We have a problem of non-communicable diseases. Communicable diseases, we recently had in 2021, the trident COVID-19 infection, in which 49 people were infected and we lost 5,31,000 people. And we're still coping with and struggling to treat actually long COVID syndrome. Our biggest problem now is actually eradication of tuberculosis. We have actually about 27% of world's population living in India. That's around 2.64 million. And added to this, we have secondary problem as well. According to Lancet 2023, we have about 197 million people with various mental disorders which we have to deal with. Currently, not communicable diseases, of course, our biggest problem is actually the obesity, to childhood obesity and adolescent obesity. We have about 250 million people with general obesity, 350 million people with central obesity, and accordingly, the incidence of diabetes, hypertension, heart problems is increasing exponentially. Can we meet with all these challenges? And up to this, we are short of doctors by about 2 million. This is according to WHO. And short of nurses by about 6 million. I suppose technical proficiency is not the problem, but main problem is actually meeting of the minds. Our minds do not meet. Although we are into actually precision medicine is something, you treat a patient based on his genetics, genes, and also based on his molecular biology. About a big bag, a 74-year-old man came to see me. He had 3 pack full of actually the MRI films. He was just flashing at me. He just wanted to tell me what those MRI films actually shows. And he has been seen by 3 doctors normally. And he said, all of them said there is nothing wrong with these MRI films. Said, can you just actually look at them once again and see what it actually reveals? I said, I didn't want to actually accept my ignorance that I don't know how to read the MRI films. I just paid him to sit in front of me, listen to his history, and this is a 74-year-old man who has been diabetic for the past about 34 years, and he's actually had the hypertension for the past about 20 years, and he had the cabbage operation 30 years back. And he's been having actually, he was feeling giddy when he actually stands up from the sitting posture or changes his posture. As a matter of fact, he had several falls and he injured himself many a times. And I took him inside and made him lie on the couch, examining him. I found him that he has got severe postural hypotension. What does that tell you? It tells you that we've actually forgone to the protocol that history taking, clinical examination, provisional diagnosis, investigations, and final diagnosis. What we're trying to do is actually putting the cart before the horse. Now, these are the days of specialization. In Shimoga, at least, the people actually go to see the specialist directly. But this is not the case abroad. In abroad, you got to actually go to your family physician. The family physician in turn has to decide whether the patient requires specialist services or not. But here, heart doctor prescribes the heart tablets and he refers him to the endocrinologist for the management of diabetes. And in turn, actually, endocrinologist, bless his heart, if he has got some other ailment, he is being referred to the third. As you age, as you all know, you tend to have at least 2 to 3 illnesses, but the unlucky ones perhaps will have more. At the end of the day, you are actually left with at least 2 to 3 boxes of drugs. Added to this, you have a problem of confusion of generic drugs. Where does it lead you? And sometimes it so happens that the same drug has actually been prescribed twice. Sometimes even the essential drugs, like say for example antiplatelets, are being actually forgotten, and patient lines up with problem. But you really require someone to sit with the patient, someone to tell the patient what are the diseases what he has, what is the lifestyle he has to follow, what is the diet he has to actually take, and what are the medications he should take. This someone in the past used to be family physician, but culture of family physician is dying down. We have only very few family physicians left in Shimoda. But unfortunately, NMC also woke up very late. It was only last year they have started MD in family medicine. But this job, according to me, if the minds meet, if the connection of the minds will be there, the minds connect, specialists also can do it very well. The third thing what I want you to actually suggest, over the years, I have come to a conclusion that you got to put three people around you when you start examining your patient. One is your nagging wife or husband not under bias, who keeps on asking you question. Is that the right diagnosis? Are you on the right track? Do you think you want to change the diagnosis? The first advice, the whole attention is to get the diagnosis right. That's the problem. And the second thing is you are an analytic teacher. You got to put your analytical teacher whom you are very fond of it. On the left hand side, who keeps reminding you, did you follow the protocol? Did you follow the guidelines? Do you want to get better with the books? Or do you want second opinion, which is unheard in Shimoga? And by then, you're naturally confused. But at this stage, you want to help actually your close friend whom you can actually motivate to back and who says, no, I think it's okay if you are on the right track to go ahead and treat the patient. So this should happen in every patient whom you actually meet. As they say, single mind is obstinate. The broad mind can be led and can lead as well. So overall, doctors are not infallible, are they? So they are also human beings. They tend to make mistakes as well. And the last point which I want to actually touch upon is actually this is the days of corporate hospital culture. As you step forward to the hospital, you will have actually wheelchair and then trolleys greeting for you. You have actually beautiful men and women with various uniforms as you walk along the corridor of the hospital. But believe me, walking on the corridor of corporate hospital is a complete joke. It's very stressful. I've done that many times. Unless all the healthcare workers, their minds unite, unless they also start thinking one day or the other, I will also be walking in this on the same corridor. Things will not be smoother for the patient. Again, benchmark used to be it is the family physician, general practitioners. I'm sure Dr. Narayan knows about it. And many a time they bring the patient to the corporate hospital, take them to the different departments, and they even drop them back to their house. How comfortable it used to be. So this will not happen, but at least, and the doctors these days do not actually participate in diagnosis, do not participate in the treatment schedule protocols to that extent what it used to be. I want to actually underline that. This is because of many several reasons. I don't want to discuss all that over here, but please, medical science has also got limitations. Many times you can't do anything for the patient. At least a tender loving care, a sympathy, or a doctor who can actually be a training doctor A doctor can even ready to actually extend the arms for the patient to rest his chin and cry. That's what is required. I then in my talk by a quotation from Herbert Hoover, who said, freedom comes from large window when the sunlight pours. Sunlight brings the human spirits. Let us actually enjoy those the sunlight of empathy, sympathy, and honesty. And let us actually create a type of all of patient little better than what we are doing by uniting the minds. Thank you for the opportunity and thank you for creating video and give back. Thank you.